with you today. Today we are going to be discussing a very important topic, which I think we need to pay attention to the way we are thinking and we are planning whatever we do for rejuvenation. So I'm going to discuss the pathogenesis of skin aging and how to design a rejuvenation plan. This is the topic of today. And before we go further, it is really very important to have an agreement on certain terms we are using. So we need to agree on what is considered as rejuvenation. When we inject someone with Botox or we inject someone with filler, is this considered rejuvenation? This is something which we need to think twice about. This is an actress called Rose McGowan. And of course, during her life, during her career, she went through so many aesthetic procedures. And at the end, she was looking like this. We can see that if we take part by part, maybe each part is looking better by its own. Her lips are looking great after all the procedures she has done. She has better looking cheek. Maybe she's looking, she's having less wrinkles or less expression lines, dynamic wrinkles, I mean. But at the end, in total, she's not looking better than before. So did she undergo rejuvenation, or she went through procedures which are giving temporary improvement, improving some features to the ideal as per the calculations? However, this is not rejuvenation. Another example is Sylvester Stallone is another actor, and we can see that after many years and after so many procedures, there are certain features, facial features, which are not really looking very good. And why is that? Because the procedures those people underwent, they were not rejuvenation. They were procedures in order to improve the look, but without achieving rejuvenation. So what is rejuvenation? Rejuvenation is restoration of the structure and the function of the skin. This is rejuvenation. If you are doing a procedure and this procedure is able to improve the structure or restore the structure to how it was a few years ago, and this is usually associated with improvement of functions, then this is called rejuvenation. So before you touch your client, your patient with a procedure, you have to ask yourself, what are you doing? Are you doing rejuvenation? Are you improving the structure and the function of the skin? Or you are doing a temporary fix? You are just improving a symptom, improving how the skin is looking without improving the structure. And our aim and goal should be always going towards the rejuvenation, the restoration of the structure and the function of the skin. This is a concept which we need to always think of and acquire in our work. It is going to make huge difference as we are going to go through this presentation. So what we would like to achieve, what we would like to retain, what we would like to regain is the healthy skin. Everyone coming to us would like to have a more healthy looking skin, whether they are coming to complain of large pores or rough skin or pigmentation or acne scars. At the end, they want their skin to be looking healthy. And this healthy skin is achieved by certain criteria. It is not just by treating the pigmentation or treating the acne scars or treating the wrinkles. It is the whole structure of the skin which needs to be healthy. So what makes the skin healthy? The skin should be smooth in order to say that this is healthy. And the smoothness of the skin requires normal keratinization. We are going to discuss about the keratinization in a few minutes, but we need to have normal keratinization in order to have smooth skin. The healthy skin is firm, and firmness of the skin requires abundant, normal functioning, two things, quality and quantity. So abundant, this is the quantity, and normal functioning, this is the quality, collagen and elastin. And we know that starting from the age of 20, we start to lose our body collagen. Every year, we lose 1 to 2% of our body collagen. So when the loss of collagen and elastin is significant, then we start to lose the firmness of the skin, which is going to be associated with larger pores, with fine lines and wrinkles, and with skin laxity. Then the healthy skin is evenly colored, and this requires properly functioning melanocytes. If the melanocytes are hyperactive, we have hyperpigmentation. If the melanocytes are hypoactive or lazy, then we get hypopigmentation. And both of them are not a very nice cosmetic look of the skin. The healthy skin is properly hydrated, and this requires intact barrier function. And this feature is very much going in line with the first one, the smoothness. So normal keratinization and intact barrier functions are going hand in hand. When we start to have abnormal keratinization, hyperkeratosis, the skin is losing the water, and then we have a defect in the epidermal barrier function. So we lose the smoothness of the skin, and we lose the hydration of the skin. And when the skin is losing the hydration, when we have dehydration of the skin, the elasticity is impaired, and this is going to affect how the skin is looking, and we are going to highlight that in a few minutes. The healthy skin is free of medical diseases. That's why if someone is having psoriasis, eczema, vitiligo, or any acne, any medical disease, it has to be treated so that the skin is looking healthy and good. And finally, the healthy skin should be free of environmentally induced deterioration. And this is actually something which we are exposed to on daily basis. Every day, our skin is being insulted with the environment, with the dust, with the pollution, with the ACs we are living in, or with the humidity, extra humidity in the weather. All those are external factors which are causing problems to the skin. This is what we call photoaging, and we have to be aware that photoaging is also accelerating the chronoaging, which we'll discuss in a few minutes as well. Now, this slide is very important because in many cases we are having telescopic vision. Someone is coming to complain of acne scars, so we focus our efforts on improving the acne scars. We don't pay attention to all those criteria. If someone is coming to complain of melasma, then we try to bleach the skin, to whiten the skin, and we forget about all the other features. Did we think for the patient of melasma if they have normal keratinization or no? Did we consider that they lost collagen and we need to improve the firmness of the skin so the light reflection is better? Did we consider the barrier function, and if the barrier function is intact so that the skin is hydrated, so that the elasticity is better? No, in many cases we don't do that, and we focus on the complaint of the patient or the client, and this is limiting the outcome. It is going to be associated with much less outcome than the optimum. And that's why it's really very important to remember those elements. Whenever we have a client, we have to examine all those elements, and then after that, we start to plan or design our treatment plan for that client. We need to address the issues, whether the patient is seeing those issues or no. It is not the job of the client or the patient. It is our job to be able to evaluate the skin properly and then design a rejuvenation plan. This is how we can do a good job. In many cases, we have patients like this who is coming and she's unhappy with how her skin is looking, and she's coming specifically to request some fillers or some Botox. 95% of practitioners will do whatever she's asking for. She's asking for Botox. Yes, they are going to inject Botox. She's asking for some fillers, then they are going to do some fillers for her, without remembering that the structure of the skin is defective. And when the structure of the skin is defective, the functions are impaired. Even if we inject her with Botox and fillers, she's going to look better, but this is not going to be looking natural. This is not going to be long-term. And instead, we have to work on the structure and the function. We need to achieve rejuvenation, and then fillers and Botox would be definitely required. but after improving the structure and the function of the skin. This is how we can get natural results, long-term results, and the patient is going to be happy. So now we move to another very important topic, which is the aging process of the skin. And when we discuss about the aging process of the skin, it is very important to remember that the skin is a body organ. And this body organ is subjected to aging as any other organ in the body. And this is what we call biological aging. When we age, we have two major changes happening in our bodies while we age. Number one, we get reduction in the basic substance of the connective tissue. So we lose the connective tissue while we age. And that's why when we get older, we become shorter. Why we become shorter? Because bone is connective tissue, and with aging, we get bone resorption. So we tend to become shorter while we age. Now, the second important change is diminished rate of cell proliferations. So cell proliferation is becoming slower, and that's why in old age, wound healing becomes very slow. While children, when they have a wound, it heals very quickly. So this is happening because of the diminished rate of cell proliferation while we age. This is the biological aging, and as I said, skin is a body organ which is subjected to this biological aging. And this is what we call on the skin level chronoaging. Chronoaging is the reflection of the biological aging. They call the chronoaging also intrinsic aging because it is due to factors from within the body. However, the skin is different than any other body organ by the fact that it is the interface with the environment. So it is the barrier which is protecting our internal body organs from the environment. And because of that, the skin is having another type of aging as well, called photoaging or extrinsic aging, which is happening due to factors, injurious factors happening from outside the body. And that's why they call it extrinsic aging. Now, as a practitioner, it is very important to distinguish and differentiate between chronoaging and photoaging because both of them are different processes and they have different pathology, and we need different type of intervention. So it's very important to distinguish between those two aging. Let us see the impact on the epidermis and the dermis for each of those types of aging. For the intrinsic or chronoaging, we said that it's a reflection of the biological aging in which there is reduction in the basic substance of the connective tissue. Okay, do we have connective tissue in our skin? Of course. What is the connective tissue and where it is? It is in the dermis, and it is the collagen and the elastin. So this is the connective tissue which is existing in our skin, collagen and elastin. So we are going to see that with chronoaging, there is collagen synthesis reduction and there is loss of elastic fibers due to the reduction in the basic substance of the connective tissue. Due to the diminished rate of cell proliferation, we are going to see that the dermis is becoming thinner, and the epidermis is also going to have fewer cells, so it's becoming thinner. Chronoaging is like when we see our grandparents with their very delicate, very thin skin. This is the chronoaging, where we lost a lot of cells and the proliferation of the connective tissue is becoming less as well. So we lost the collagen and the skin is becoming very thin. So this is the chronoaging. On the other hand, photoaging is a different pathology because it's a protective mechanism. The skin is feeling that there's injury coming from outside, so it's trying to protect itself by becoming thicker. So the epidermis is going to have hyperkeratosis, the stratum corneum is becoming thicker, and this is having negative impact on the skin, as we are going to see. And also the dermis is becoming thicker with stretched blood vessels to bring more nutrients, and the inflammatory infiltrate, the cells of 4. So this is the photoaging. So if I would like to correct chronoaging, then the main objective of the treatment I would like to do is to stimulate the collagen, to do something for rebuilding of the collagen. If I want to fix the photoaging, then the main problem I am facing is the hyperkeratosis. So I need to deal with the hyperkeratosis. So this is what we need to do. Now, the The other question which we need to think of, is it possible to have chronoaging without photoaging? Of course, the areas of our skin which are not exposed to the light, not exposed to the sun, not exposed to the environment, it is going to undergo chronoaging with no or very limited photoaging. So in this case, we don't have hyperkeratosis. However, if we have photoaging, then by the time we have photoaging, there will be definitely a degree of chronoaging, because photoaging will accelerate the chronoaging. So by the time you see that the patient is having hyperkeratosis and they have photo damage, then you have to be aware that they have also chronoaging and the collagen is impaired in their skin. So we need to do something in order to stimulate the collagen formation. Another important thing which we need to remember is that aging is associated with poor or slow microcirculation, which affects the veins, the arteries, and the lymphatics. When the lymphatic drainage is impaired, this means that there will be accumulation of toxic waste metabolites in the tissue with low level toxicity and impairment of the functions of the area which is affected. And that's why during the process of rejuvenation, it's important to have a procedure which is associated with improvement and stimulating enhancement of the microcirculation. Veins to improve the venous drainage, arteries to improve the circulation and the blood supply, and lymphatics in order to remove all the toxins which accumulate with the poor lymphatic drainage. This is a very vital point, and many people who are aware of that, like plastic surgeons in many cases, who know about that, before they send their patients for the liposuction, they send them for a few sessions of endermology, for lymphatic drainage, for massage, in order to improve the lymphatic drainage and the microcirculation, so the downtime after the liposuction will be much less and the healing power of the tissue will be much better. Also, many beauticians who are aware of that are having a small device for vacuum in order to enhance the lymphatic drainage and the microcirculation, because whatever they do afterwards is going to be much better in impact when we have better microcirculation. And that's why this is something which should never forget. It's very important to remember that our skin is composed of 3 distinct layers: the epidermis, which is composed of 2 layers as well, then the dermis, which is having the collagen and elastin, and then we have the subcutaneous fat and tissue. And each of those 3 layers is having certain functions. And when the structure of those layers is changing with aging, with many factors we are affected with, the functions will be affected, and this is going to be reflected on the appearance of the skin. And this is what we call skin aging, the changes happening in our skin. Let us discuss each layer of those and see what changes are affecting those layers. So if we start with the epidermis, the normal healthy composition of the epidermis should be like that: 35% corneocytes and 65% living cells. This is the normal healthy composition of the epidermis. However, with aging, with photoaging namely, we are going to see that the layer of corneocytes will increase from 35%, will jump to 60%, as we can see here. So when this happens, the thickness of the epidermis is not going to be more, it is the same. So when the corneocytes increase to 60%, this is going to be on the expense of the living cells, which are going to diminish down to 40%. From 65%, they are down to 40%. When someone is having this composition of the epidermis, do they come and say, we have hyperkeratosis? No, they don't know what hyperkeratosis means. It is our task to diagnose that this is hyperkeratosis and we need to intervene with that. So what are the complaints they are coming to complain of? They are coming to tell you, I don't have fresh looking skin. My skin is not fresh looking, it's dull looking. And when we examine that patient, we don't have major issues, but the skin is looking dull. It is not looking fresh. And why is that? Because when the living cells are less, it is about 50% reduction. when the living cells are diminished like that, then the nutrition is impaired. So we have a degree of malnutrition in this case. The other complaint they are telling you is that I'm using the best brands of skincare products, but nothing is working well. So they are really using very good brands of skincare products, but those products are going to be trapped in the epidermis. So the epidermis is like that, thick layer of corneocytes, and this is going to be acting like a sponge. It is going to absorb the active products, and of course, it's not going to utilize it because those are dead keratinous cells. And whatever penetrates will find less number of living cells to work on. So the effectiveness of whatever we apply on the skin is going to be minimal. The third and the most important complaint is that when we have hyperkeratosis, we are losing one of the very important functions of the skin, which is called the barrier function. In order to have appropriate and good barrier functions, the corneocytes should be overlapping. They're supposed to be in very good contact with each other, and this requires the normal keratinization. When we have abnormal keratinization and there is overcrowding of corneocytes on the skin, there are gaps and cracks in between the cells like this, and this will allow what is called transepidermal water loss. So the skin is vaporizing the water, and when the skin is vaporizing the water, the patient is coming to complain of dryness. And I'm going to discuss that in a minute. However, over that, those people are always complaining that there is irritability of the skin. So the skin is very irritated. Whatever they apply on the skin, it is causing a lot of irritation because the barrier function is defective, and anything can go into the skin, into the deeper layers of the skin, and cause a reaction and stimulate an immune reaction. Also, those people, because the barrier function is not there, it is very weak and is disturbed, so they get recurrent infections. And bacterial infections, fungal infections, and viral infections are becoming very frequent. That's why this damage in the barrier function should be dealt with. So this is something which is going to be manifesting when we have damage in the barrier function. Regarding the transepidermal water loss, it is really very important to remember that when we lose the water, our skin is losing the elasticity. And this is a very good example, which I always like to highlight. This is a baby who is having gastroenteritis. Gastroenteritis is associated with vomiting and diarrhea. So when we have some parents who are having this problem with their child, we teach them that test, that every now and then they have to pinch the abdominal skin. When the abdominal skin does not retract, like this photo here on the right, then this is a sign of dehydration, and they have to rush to the hospital because this baby requires intravenous fluids. So this shows you the importance of the skin hydration for the skin elasticity. When the skin is losing the water, then definitely the elasticity is going to be impaired, and sometimes the problem is not as major as what we are seeing in this photo. When it is happening on the microscopic level, then the patients are coming to complain of roughness of the skin. They lose the skin smoothness, so the skin becomes more rough. When we have lost some of the elasticity of the skin, then we are going to have large pores, and we are going to have fine lines and wrinkles. All those issues are happening due to the impairment of the skin elasticity, because of the impairment of the hydration of the skin, because of the impairment of the barrier function of the skin. So this is something which we have to remember, because in many cases, when we see someone who is complaining of wrinkles, we rush to stimulate the collagen, or we rush to inject Botox or fillers. No, first step is to improve the epidermal barrier function. This is the first thing, because this is the simplest thing. And if we don't do that, whatever we do at the level of the deeper layers of the skin, it is not going to work well. So in many cases, patients are coming to complain of things beyond the surface of the skin. However, if we look carefully to the skin, we are going to see that there is impairment of the structure and the function of the epidermis, and we have to fix that. Otherwise, the outcome of whatever we do in the lower layers of the skin will not be optimum. The patient will not be satisfied and will keep moving from one clinic to another. So this is very important. Now, when we have this structure of the skin, of the epidermis, we have to do something which we call keratolytic procedures, and we are going to discuss what are the options in order to remove part of the stratum corneum, and this is going to be considered as trauma to the skin, which necessitates activation and stimulation of the repair mechanism, of the proliferation. So when we remove some layers of the corneocytes of the stratum corneum, this is going to stimulate the basal layer to proliferate, so we are able to return the composition of the epidermal back to normal within a few weeks. So we would like to change this epidermis into that one, this epidermis into that one, and in this case, the absorption of anything we apply on the skin is going to be much better. The skin sensitivity and irritation will be much better. The hydration of the skin, so the elasticity and the smoothness of the skin is going to be much better. So this is what we need to keep in mind. Does it make a difference if we inject fillers or Botox in someone who is having a well-functioning epidermal barrier or no? Definitely. If we are injecting fillers in someone who is having intact and healthy epidermis, then the hydration of the skin is going to be much better and the fillers are going to stay much longer. And the same happens for the Botox. If we are injecting Botox for dynamic wrinkles, so it is targeting the muscles so that we are relieving the dynamic wrinkles. However, if the skin is well hydrated, then the elasticity is going to be much, much better. And in this case, even the static wrinkles are going to improve. So it's going to be much more natural looking and it's going to stay much longer. When we are using devices which are enhancing and improving the microcirculation, then the lymphatic drainage is much better, so the tissue is healthier. The edema, the erythema, the downtime after procedures, the inflammation will be much less. So it makes huge difference if you are injecting fillers or Botox in skin which is having normal and healthy epidermal barrier function, and those who are having defective epidermal barrier function. It is a big difference. When it comes to the dermis, it's very important to know that it is composed of 75% water, which is required to maintain the barrier function, 20% proteins, collagen and elastin, and in chronoaging after the age of 20, we start to lose 1 to 2% of our collagen per year, and the photoaging can double this loss. So this is something which we have to remember. That's why in many cases, we might need to do something to stimulate and rebuild the collagen. So when we talk about rejuvenation, we have to understand that rejuvenation is a whole concept. It is not a procedure. It is not some fillers or some Botox or some fractional laser or some microneedling. It is a whole concept where we need to achieve 5 cosmetic targets. We need to improve the skin condition and removal of the skin damage. We need to stimulate cell division. We need to guarantee the skin nutrition. We need to improve the cell functions. And finally, we need protection and anti-aging treatment. Otherwise, the problem will come back very soon. We are limited because practitioners cannot do the whole 5 cosmetic targets. We can do a procedure in our offices to improve the skin condition, removal of the skin damage. And usually this is going to result in stimulation of cell division. What about the 3 remaining cosmetic targets? This is the homework of the client, of the patient. They need to be aware that there is a plan of procedures which they need to keep maintaining, and some skincare products according to the situation, which they need to use in order to maintain and improve the outcome of the procedures we perform. They need to drink enough water. They need to eat healthy food. They need to use sunscreens. If they didn't do their part, then the procedures we perform are going to be limited with the outcome and limited with the durability. So this is something which we have to have an agreement about with our clients. Otherwise, they are not be satisfied with the outcome if they are not aware or if they didn't comply with our advices. So when we do rejuvenation, we need to change the structure of the epidermis from this one into that one. At the level of the dermis, we need to stimulate the collagen, and this is something which is happening, the collagen loss, and it affects mainly the upper dermis, where we can see that the tissue is very pale. We don't have the collagen bundles which are existing in the lower levels of the dermis. However, in the younger skin, we can see that the collagen bundles are intact and it is there. So we need to do something here at the level of the upper dermis to stimulate the collagen so that the skin is returning its firmness again. And of course, if there's skin laxity associated with the loss of collagen and the impairment of the epidermis, we need to tighten the skin. In many cases, patients are not aware of all the problems and all the layers of the skin. So they might not complain of everything they have. So it is our task to spot the areas of problems and discuss it with our clients and our patients. This is our job. In many cases, when they don't complain of the laxity in the neck, for example, and they focus on the face, we start to work on the face, but after a while, they'll come to complain of the neck. My face improved, but now my neck skin is damaged because of what we did to the face. No, the damage was there from the beginning and we didn't address. And when the problems in the face improved, then the neck becomes more prominent. So they start to realize. That's why it's very important to evaluate the skin laxity. And if there is skin laxity, then this has to be addressed with all the other procedures which we are going to do. So what tools, what procedures we have in order to achieve rejuvenation? We have topical preparations, which are usually improving the epidermis. We have microdermabrasion and hydrodermabrasion. This is mechanical peeling, which is one of my favorite ways. We have tissue augmentation for static wrinkles and for volume loss. We have Botox injection for dynamic wrinkles, and this is targeting the muscles, not the skin. Then we have skin needling with or without fractional radiofrequency. We have tissue tightening with radiofrequency and with infrared light sources. Then we have the laser rejuvenation, which is of different ways, the non-ablative rejuvenation, the fractional lasers, and so on. And finally, we have surgical procedures. How to select from those options? Before selecting any of those modalities, it's very important to diagnose the problem. What is the problem? Is it in the epidermis, or in the dermis, or in the subcutaneous tissue, or all of them, or two of them? This is our task, to diagnose where is the problem. Once we diagnose where is the problem, then we are going to select from those different procedures according to the level of the problem. So the next step is going to be aware where each of those procedures is going to exert the effect. For example, if we talk about skin needling, is it going to improve the epidermis? No. Is it going to cause skin tightening? No. This is a procedure to stimulate the collagen. The same applies for fractional resurfacing, for example. So it is very important to be aware the mechanism of action of each of those procedures. Botox injection, is it going to improve the epidermis? No. Is it going to stimulate the collagen? No. Is it going to tighten the skin? No. It is working on the muscles. So this is how we should evaluate each of the procedures we have in our hands in order to be able to utilize each of those tools in the right way and with the right expectations. In many cases, we might need combination of different procedures in order to be able to address all the layers of the skin, if this is our goal and if this is the case. So this is the way of thinking. This is the concept which we need to implement when we do rejuvenation. So the concept of 3D rejuvenation is a concept where we would like to target the epidermis, the dermis, and the subcutaneous tissue for tightening. Of course, we don't need to do that in every single patient. For example, if you have a patient who is 25 years old and the main complaint is acne scars, in this case, I don't think they have skin laxity. So tightening would not add anything. They definitely need something at the level of the epidermis. They definitely need something for the dermis to stimulate the collagen. So we need to combine different procedures in order to achieve that. However, skin tightening is going to be required in older patients who are coming to complain of, for example, prominent nasolabial lines, where prominent nasolabial lines in many cases means that there is a degree of skin laxity. So tightening the skin is going to help to improve the problem. Of course, epidermal improvement is required with old age. As a matter of fact, not with old age. Epidermal improvement is required in every single person you are going to see. Once you have seen a client to complain of anything, by the time you are seeing that client, the epidermis is already impaired. We have to know that if we start to lose collagen by the age of 20, then the epidermis is impaired even before the collagen, because it's the uppermost layer of the skin. This is the layer which is affected by everything we are exposed to. So the epidermis and epidermal repair is a requirement in every single client we are seeing. For me, this is a must for everyone, whether they are coming to complain of large pores or dull looking skin or melasma or hyperpigmentation or photo damage or wrinkles, whatever, the epidermis is going to be in need of improvement. So what are the procedures we have for improving the epidermis? We can prescribe retinoids, but retinoids need to be used for 6 months, and sometimes it causes skin irritation. If it is not used properly, it needs to be used gradually in order to avoid the irritation of the skin and the peeling. Then we have another option, which is the chemical peels. Chemical peels is another good option. However, it needs very good preparation for the skin before we do the chemical peeling, and it needs very good care of the skin after the procedure. Otherwise, if the skin type is dark, Fitzpatrick 3 and above, then the incidence of hyperpigmentation after the chemical peel is very high. So it needs very good skin care before and after the procedure. Then we have the microdermabrasion with different types. And this is mechanical peeling, which is my favorite way of improving the epidermis. Why? Because number one, it's mechanical, it's not chemical, so it doesn't have any potential risk of hyperpigmentation. We see what we are doing, and it is very much controlled. Number two, besides the structural improvement of the epidermis, we are able to improve also the microcirculation because of the movement with the handpiece. So we are able to improve and enhance the lymphatic drainage and the microcirculation. So it is really my favorite way of improving the epidermis. Then we have the laser peel, which is the superficial ablation of the skin. And this is very effective. Usually one session is going to be enough. However, again, very good skin preparation and very good skin care afterwards is required. Otherwise, we are going to have a higher incidence of hyperpigmentation in dark skin and higher incidence of prolonged erythema in light skin types. The downtime, which is not a case, a risk in microdermabrasion, make it much more accepted by everyone, because today everyone is living in a very dynamic world and no one accepts the downtime. So the only procedure out of those which is not associated with downtime at all is the microdermabrasion. The retinoids might be associated with some irritation in the beginning unless we are able to use it, and it requires 6 months. So that's why I really prefer the microdermabrasion. Regarding the dermis and the collagen induction therapy, what are the options we have? We have the skin needling, which is again one of the very nice techniques. When we don't need heat, it is stimulating the collagen in a very effective manner. We have also the microneedling radiofrequency, where besides the needling, we have also fractional radiofrequency, which is emitting some heat, and the heat is going to improve the tone of the skin besides stimulating the collagen. Then we have the lasers, which are different types: fractional lasers, ablative fractional, non-ablative fractional, non-ablative lasers. We have different types of lasers, and also the PRP is used in conjunction with the other procedures to enhance the results. We cannot use it as a monotherapy. Its effect is going to be very weak, but it has very good synergetic effect with the other procedures. Then if there is skin laxity, we need to tighten the skin, and we can achieve that by different modalities. Also, we can use the radio frequency, which is the most popular way to tighten the skin. Then we have the infrared light and lasers. We have HIFO. We can also tighten the skin or lift the skin with threads or even with surgery. So those are different modalities, and the common mistake in this area is that we see a client or a patient who are coming to complain of acne scars. And before he visits us, he's telling us that he went to 4 clinics before. And all the 4 clinics were doing procedures because it's acne scars, which is focusing only on collagen induction therapy. So he went to one clinic where they did for him derma roller or derma pen. And then he went to another clinic where they did for him microneedling radiofrequency. And then he went to a 3rd clinic where they did for him fractional lasers. And then he went to a 4th clinic where they did for him PRP. Of course, it's going to be limited because the collagen in the skin is having the capability of the skin to regenerate collagen is limited. If we do one procedure to stimulate the collagen, then we are getting some collagen stimulation. If we did 10, the collagen stimulation is not going to be tenfold. No, there is a certain capacity for the skin. So instead of focusing on stimulating the collagen by different modalities, we should target the different layers of the skin. So in this case, we are going to improve all the layers of the skin instead of focusing on the dermis only and leaving the other layers of the skin without being addressed with the problems and the structural changes they have. So this is a concept, again, which we really need to think of. You need one of each of those columns if there is impairment affecting the 3 layers of the skin. So diagnose where is the problem, and then choose your tools and build your rejuvenation plan. This is how it should be. When we do that, we are going to improve how the skin is looking in a very natural way. This is a patient who came to me, and she was asking for some fillers to improve the nasolabial folds. So I told her, okay, let us do some procedures in order to improve the structure and the function of the skin, to rejuvenate the skin. And then we decide if we really need fillers or no. And we did for her all the 3D rejuvenation concept, where I did for her the microdermabrasion, and then I did for her tightening because she has some skin laxity, and then I did some non-ablative rejuvenation with lasers. And then after one session, after 1 month, she came back extremely happy. We can see that her skin is becoming much healthier, and she said, okay, now I don't need fillers. I feel I'm very satisfied with what I'm getting. So this is what we can do when we are able to address the different layers of the skin in a good and in a professional way. One of the procedures which was very popular is the microdermabrasion, and this is something I started to use about 20 years ago, which is having the diamond peel. Sometimes it has crystal peeling with aluminum oxide. And this was something we used about 30 years ago for mechanical abrasion of the corneocytes. And at the same time, it has vacuum, so it can stimulate the lymphatic drainage. Usually the procedures are done 4 times, once every 7 to 10 days. And then after that, after the 4 sessions, it is recommended to have a session every 3 months so that we are able to maintain the epidermal barrier function in a good way. A more advanced technology, which I started to use recently, about a year or a year and a half ago, is the Geneo Plus, where this is a platform composed of 3 technologies. The Oxygeneo, which is having exfoliation, and also it has Capsogen, where it is stimulating the oxygenation and infusion of some products into the skin. Then it has also tripolar, which is the radiofrequency in order to tighten the skin. And it has also ultrasound for sonophoresis, where it can push certain products into the skin for improvement of the hydration and the nutrition of the skin, or to transcutaneous delivery of certain medications like for pigmentation and so on. So it can have different functions in order to improve the epidermis. This is one of the very good techniques which I started to have in the clinics I work at, and it is really having significant improvement of the outcome of the procedures. And this is a short video which is showing how it works. So this is the capsogen, which is generating something like topical carboxytherapy. Instead of injecting the carbon dioxide, we are just having a chemical reaction and a mechanical abrasion or exfoliation of the skin. So we are improving the oxygen infusion into the skin from within in a very normal and physiological manner. So this will improve the oxygenation, and also the nutrients I mentioned are going to be in the capsogen in order to address certain problems in the skin. So this is the Oxygeneo, which is, as we can see, it has many benefits on the level of the epidermis. Of course, with the radiofrequency imposed, then we are able also to tighten the skin, and this is something which is very positive synergy. Then we go to the dermis, where we need to achieve collagen induction therapy, and one of the techniques which I really like is the RF radiofrequency microneedling or fractional radiofrequency microneedling, and this is the latest advancement in the delivery of radiofrequency energy. And this technique is combining two other techniques, the needling and the fractional radiofrequency. The needling concept started actually long time back with the use of the derma roller, which is a disposable device which is rolled over the surface of the skin to induce small micro channels. And it has been reported with excellent outcome in many cases without any side effects, without any complications, because this is not associated with heat. So the healing is very quick, and usually in few hours, everything is back to normal. And it has very strong stimulation of collagen. It is my preferred technique for patients who are at high risk of hyperpigmentation, like Asian population. They are having very high potential risk of hyperpigmentation whenever we are using techniques and procedures associated with heat. So that's why when we are using the dermal needling, we don't have this risk because there is no heat associated. And we can see how much the pores and the acne scars can improve with this technique. It has been used a lot in different indications for rejuvenation, and always the outcome is really amazing. We used it also in some cases of post-burn contractures, and to our surprise, it worked very well by improving the contracture in the skin. And this is something which we can do. It is used in many cases in combination with some topical cocktails in order to enhance the absorption. And again, the outcome is usually very satisfactory. The procedure is very simple. So we need to apply numbing cream before, and then we start to roll the derma roll over the skin in different directions. There will be some pinpoint bleeding, but immediately after the procedure, we wipe off the blood and the skin is going to be erythematous. And this will continue for maybe 1 or 2 hours. This is the same patient 5 hours after the procedure, and the skin is almost back to normal. It is very safe in dark skin, and we can see when the patients are young, acne scars does not need heat. So the derma needling is going to be enough by itself. You don't need other procedures to stimulate the collagen. It is enough. But definitely we need something to improve the epidermis along with what we do to stimulate the collagen. Now, does this patient requires radiofrequency or something to tighten the skin? Most probably no. We perform a small test where we stretch the skin. If we stretch the skin slightly and we feel that the acne scar improved, then tightening is going to be required. And in this case, I would use the radiofrequency along with the Oxygeneo. If we stretch the skin and the acne scar does not improve, then it means that there is no skin laxity, and then the radiofrequency step is not going to be required. This is how to evaluate what is required in the patient we are treating. And this is another patient, and we can see the acne scars and how they improved significantly after treating the patient with the derma roll. Also, we have the motorized rollers, the micropen, the dermapen, and other procedures. How does it work? This was something which was introduced in a study in Nature magazine or journal in 2006, which discussed the electrical potential inside the cells, which was found to be minus 50 to minus 70 millivolt. This is when there is resting. The cell is resting. There is no injury. However, they found that if we have an injury, we know that if we have a wound, this wound is a stimulus for the cell proliferation. So they studied so many factors, and they found that one of the most significant change happening is the increase in the negative electrical potential. So it goes up from minus 50 millivolts up to minus 100 millivolts. And this is associated with enhancement of the proliferation and the repair mechanism of the tissue. They found that furthermore, if we insert steel needles into the skin, the negative electrical potential is going to jump up to minus 150 millivolts. And with this enhancement or increase in the negative electrical potential, the repair of the tissue is going to be much more, and it is going to stimulate the proliferation of the cells. And that's why the skin needling is having very strong stimulation of the repair mechanism. Now, is this negative electrical potential increase the only mechanism of action of the needling? No. Also, they found that when we do the needling to the skin, this will stimulate the local blood circulation, and enhancing the local blood circulation will bring more growth factors and nutrients to the area. So it is going to be much more healthy. And also, this is going to stimulate a mild inflammatory reaction. So mild inflammatory reaction is going to be associated with the migration of fibroblasts, and fibroblasts will synthesize new collagen. So we are building collagen in the skin, and that's why this is called CIT, or collagen induction therapy. So those are the mechanisms of action: increase the negative cell potential, increase the local blood circulation, stimulation of mild inflammatory reaction, and in case of scars and fibrotic tissue, it breaks and fragments the fibrosis, because with inflammation, there is an enzyme called collagenase. Collagenase is an enzyme which is responsible for eating up and decreasing the fibrosis. So that's why we can use it in the scars. And finally, it was found to increase the absorption of topical agents. And this was a study conducted in Marburg University in Germany, where they applied some liposomes on the skin without any needling, and they found only 0.3% can penetrate the stratum corneum. And then they performed the needling and they applied the same liposomes, and they found that there is up to 200 times more substance can be delivered with the dermarol. Two important things. Number one, in order to achieve that with the needling, you don't need a large or a long needle. 0.3 to 0.5 millimeter needle depth is enough for enhancing the absorption. However, if you need to stimulate the collagen, you need a length of a needle of 1 millimeter or longer. So if you are using a dermarol with 1 or more millimeter needle length, then it's going to stimulate the collagen and enhance the absorption. So the other thing is that it is very important to be careful what we apply on the skin after the needling, because the absorption is going to be significant. So if it is something good and beneficial, the benefit is going to be enhanced. However, if it is something which is irritating the skin, like peels, for example, or some retinol or whatever, then the irritation might be much more. So it's very important to be careful what we apply on the skin after the dermal needling. So this is something which we can use in order to enhance the delivery of topicals, like cosmeceuticals, like biologicals, and PRP, like pharmaceuticals. There are many published studies about using the dermarol along with the hydroquinone in order to enhance the absorption of the hydroquinone in case of melasma. So this is a well-established method of enhancing the transcutaneous delivery of medications now. So what about the fractional radiofrequency? This is a new concept where RF is delivered either in contact mode or via needles in precise and specific points to exert the effect precisely instead of the bulk heating. And in this case, of course, we are getting more reproducible results than the bulk heating of the classic RF. there are many studies which were published to demonstrate the effectiveness of the fractional radiofrequency. And this is one of the important studies which studied the impact on the genes involved in dermal remodeling. So if we see the fibrin, tropoelastin, procollagen 1 and procollagen 3, and we see the values of the control, and then what happens immediately after the procedure, there is slight increase. However, in 28 days, we are going to see significant increase in those very important markers, which denotes that the impact of the fractional radiofrequency is not a temporary effect. It is not some erythema and edema which is going to subside. No, it is a long-term improvement of the structure and the function of the skin. This is the rejuvenation. This is the real rejuvenation, when we are able to enhance the structure and the function of the skin. And those are the photos of the patients, where we can see here the procollagen 1, which has increased. This is the baseline, and this is 4 weeks after the final treatment. And this is another patient, and we can see how much enhancement of the procollagen 1. And this is the elastin, the fibrin 1, where we can see before and how much it increased 4 weeks after the final treatment. And again here, another patient. And regarding the histopathological study, we can see that there is increase, and very significant increase, in the collagen 4 weeks after the final treatment. This is the structural improvement achieved by that procedure. And this is the elastic fiber. Also, we can see very nice enhancement and increase in the elastic fibers. This is how we are improving the structure of the skin, of the dermis. So the benefits of combining the needling and the RF is controlled heating of the dermis and the subcutaneous tissue, enhanced dermal collagen remodeling, immediate collagen change in the collagen structure, and long-term stimulation of neocollagenesis starting 4 to 6 weeks after the treatment. So it's very important to let people, patients, clients know that the procedure is going to be effective, definitely 100%. However, it takes time in order to show. We'll get the immediate collagen contracture, but also the improvement of the structure of the skin is going to continue to happen for about 6 months after the final procedure. So it's very important for them to know that. We have different ways to deliver the radiofrequency. We have the non-invasive radiofrequency, and we have the microneedling radiofrequency. When we are selecting a microneedling device, whether it's the rollers or the microneedling radiofrequency, it's very important to make sure that we are getting good quality products, because if it is not of good quality, then it is going to be thicker needle, which is associated with more pain. But more importantly, it is going to be bending like that with the repeated insertion into the skin. And if that happens, then those needles are going to bend and they are going to act like hooks. So it can cause minute fibrosis. That's why it's very important to make sure that you are getting very good quality products. Otherwise, you will be causing problems instead of fixing problems. So this is something which is really very important. The other thing is that those are disposables. So when we are using a dermarol, it should be used once for the patient and then dispose it. You cannot use it again. Number one, there is no good way to sterilize it. Number two, there is wear and tear. So even the good quality products, you are not supposed to be using them more than once, even for the same client, because of this wear and tear, which is going to affect the tip of the needle. So again, this is something which we have to keep in mind. The effect of the fractional radiofrequency on the skin is just like the non-ablative fractional laser. And that's why I'm always saying that whatever the non-ablative fractional laser can do, the fractional radiofrequency microneedling will be able to do. And this is how the skin is looking immediately after the procedure, some erythema, and we can see very well where we treated and where we didn't treat. So it's very easy to go back and treat the areas which were not treated. And in 24 hours, the skin is back to normal. So we can see that the downtime is very limited, and this is something very important for many clients. Those are the results which we can achieve with this technique, the fractional radiofrequency microneedling, where we can improve the static wrinkles without the need of fillers. It stimulates the collagen. Of course, it's very important to work on the epidermis because this procedure will not improve the epidermal barrier function by itself. So I always combine something like the oxygeneo with the microneedling radiofrequency. And this is the outcome when we are doing good job. In one procedure, we can see how much the skin improves. And this is the same patient. We can work very close to the eye because it is safe to work on the lower eyelid up to the eyelashes. There is no issue at all. Of course, we don't work on the upper eyelid because there is nothing to put the handpiece over. So we are working on the lower eyelid, and we can see how much we can improve the area around the eyes. It can work on stretch marks as well, but this requires combination treatment. I always combine that with PRP injection, but we can see very significant improvement of the stretch marks. Pores on the nose, it is one of the best techniques I have used. As we can see, very nice improvement of the pores. But again, this should be associated with something which improves and enhances the epidermal barrier function as well. And this was a split face comparative study between fractional microneedling device on one side and fractional carbon dioxide on the other side. So we can see that half of the face was treated with fractional radiofrequency and the other half with fractional carbon dioxide. And they were found, both of them, clinically equivalent. So both the microneedling radiofrequency and the fractional CO2 were associated with moderate improvement in most patients, and the number of active acne lesions was significantly decreased on both sides. However, the downtime was significantly higher with the CO2. So patients were requested to do a second session, but they refused. They said, we are willing to be treated with the fractional radiofrequency only, but not with the CO2 because of the longer downtime. So there are so many ways to improve acne scars. This is, for example, results achieved by non-ablative rejuvenation in association with microdermabrasion. This is with non-ablative fractional laser, and this is with ablative fractional laser. So the question is, what if we don't have a laser? In this case, this is a patient who was treated and improved with dermal needling. So always we have to think of where is the pathology and what are the tools we have in our hands. So there is no limit. I mean, microneedling sometimes can get as good results as the laser. It depends on the situation. Do we need heat? We don't need heat. Do we need to do combination with something to improve the epidermis, or do we need to do combination with something which tightens the skin, and so on? As long as we understand the pathology and we understand our tools, we'll be able to design a very good rejuvenation plan. Now, what about the subcutaneous tissue? With the subcutaneous tissue, we need deep tissue heating in order to tighten the skin, and this is something which can be achieved by the tripolar radiofrequency, where we can use the tripolar in order to emit heat to the deeper layers of the skin, and this is going to lead to contraction and improvement of the tone of the skin, and the heat is going to lead to secondary stimulation of collagen, so we are getting double benefit. The radiofrequency is going to be emitted in a way where the more water we have in the tissue, the more heat. So the deeper layers of the skin are going to be heated much more than the upper layers of the skin. And that's why the collagen stimulation associated with radiofrequency is less than the collagen stimulation we get with the microneedling radiofrequency or with the skin needling. And that's why combination is required. Now, what happens if we don't do anything about skin aging? We are going to age. And it is not only women who age, of course, men as well age. So we can see that aging is a continuous process. And about 20 years ago, this was the way. No one was taking any precautions to delay the signs of aging. And it was taken for granted that we have to age, and this is the normal thing. Today, we started to have more awareness that there are procedures which we can do in order to delay the signs of aging or revert the signs of aging if they occurred already. And this is the anti-aging program concept, where people are required to come 3 or 4 times per year to do procedures after the initial sessions. And most of the procedures I discussed are associated with almost no downtime, with reasonable cost, because this is something which can be stretched over the year instead of asking the patient to pay $2,000. No, it is going to be over every month's payment, so that they know that they are coming after 2 months or 3 months, but they don't need to pay one bulk payment. It's going to be stretched over the year. And there is no high expectations. If someone is having a scar and they are coming to treat a scar, after the treatment, every 5 minutes, they are looking at the mirror. Is the scar still there? So this is something which is really associated with a bit of irritation. However, when the objective of what we do is to improve what we are doing, but there is no high expectations, then everyone is happy. And in 10 years, this is what we are giving those clients. In 10 years, patients will look the same or even better. This is one of my patients, where if we look at those two photos, I think we can agree that this photo, the patient is looking about 10 years younger than here. However, the fact is that this was her photo in 2012, and this is her photo in 2015. So here she is 3 years older. However, she is looking about 10 years younger. I think we can see clearly that the skin improved with the combination of procedures I just mentioned before. Here she was 68 and now she's 71, and we can see that she is looking much younger than 3 years ago. This is the same patient, and we can see her neck and how much we improved the quality of the skin. And again, this is her face, and we can see the elastosis and those lines and wrinkles and how much they improved in a very natural way. This is the other side of the face, and we can see the elastosis and how much it improved. This is another patient in 2012, and then 3 years later, and we can see how much the skin became much healthier, looking in a very natural way. And this is a third patient, where we can see over the years that her skin is improving. So it is not only stopping the aging, but it is reverting also the signs of aging. And this is what we would like to achieve, and this is what we call anti-aging. One of the important things to highlight before I close this presentation, before I end it, is that sometimes when the changes are happening gradually and slowly, patients forget how they were looking. So this is a patient who came after we did for her 3 sessions of combination treatment, as I mentioned, and she was claiming that she did not improve. So I said, but I feel you improved. She said, no one is commenting that I'm looking better. So I said, okay, let us see the photos of before. And when we put the photos of before besides her photos now, she opened her mouth. She didn't realize how much her skin improved. And this is happening when we are doing something not having very fast effect, not having immediate effect, more physiological, more gradual improvement. And that's why documentation is very important in order to have a reference and in order to be able to demonstrate the changes and the improvement occurring to the skin. So this is a very important thing, to have photos and to highlight the problems and to be able to demonstrate the changes and the improvements happening to the skin. So at the end, it is very important to remember that when we are working on the skin, it's very important to remember the 3 layers of the skin, to examine the skin, see where are the problems, and then design the treatment plan, which is going to address the problems in the different layers of the skin. And by that, I would like to end that presentation. And I would like to thank you all for being here, for listening, and I hope you enjoyed it. And if you have any questions, please don't hesitate.
Thank you so much. I think it was fantastic, and I am sure I need to see it once more, and we will send the recording of this presentation to everybody. But I think there's so much information and so useful information. Thank you very much for the presentation.
My pleasure.
We a little bit over time, so I suggest, if I may, let's ask the guys on the call to send us an email with the questions, and okay, we may respond via email, or we'll find some other opportunity. Hopefully we can do it on a regular basis, and we can address questions in the next session or in the few sessions to come.
Okay, I agree. Perfect.
Thank you very much, Professor Badawi. Appreciate very much your knowledge and your presentation. Thank you so much.
Thank you very much for arranging that webinar. And again, I would like to thank all the audience as well. And if there are any questions, I left my email, and of course they can send the question to them as Park. I'll be very happy to answer any questions.
I just want to tell you, while we are closing, I see some responses here. Thank you, amazing, thank you, and thank you. So everybody is thanking you, and it really was amazing. It really was amazing. Thank you very much for that.
Thank you. Thank you.
Thank you very much, everybody. Have a good evening, good night, wherever you are. Bye-bye.
Thank you. Bye-bye.